Hello, my name is Anthony Hernandez, and I am going to be playing the role of the Chief Medical Officer for Case Study 2 in Public Health 858. Um, Ultimately, I'll be going over the interventions that I would do as a Chief Medical Officer, but also the role that I would play as a Chief Medical Officer in this scenario of COVID-19 outbreak that has happened. I thought it was a very influential, well, not influential, but a very important idea to really understand the magnitude that the coronavirus outbreak had on not just the individuals that it affected, but also the individuals that were in charge and the weight that it can have on the decisions you make, affecting millions and millions of people, and in some cases, a community that you care very much about. So hopefully going forward that you understand a little bit of the interventions and the idea of a chief medical officer for this case study. So let's just start with what is going on. So December 31st, 2019, that's when China reported a cluster of the cases of pneumonia in people associated with the Hunan seafood wholesale market in Wuhan. And then January 7th, the Chinese health authorities confirmed that the cluster was associated with the novel coronavirus. And then January 30th, that's when there was a total of 9,976 cases that had been reported in at least 21 countries. And then we had the first confirmed infection in the United States, January 20th. Now, as of April 24th, going forward into where we're closer to where we're at, 2.7 million cases have been confirmed with 194,000 deaths across 185 countries. And then as of our last date, according to our data that we were given in our case study, June 5th, 6.75 million cases was confirmed and 393,000 deaths across 210 countries. So what now? We have all of this information. We know what's going on. We see the effects that this virus is having. Now, what do I do as a chief medical officer? It's often we get bogged down by so many roles and so many different hands that we could put our different things we can put our hands into to make a difference. But I think ultimately, the first role, and that's why I put it first, was to protect the community. As a chief medical officer, my main objective is to do whatever is capable within my ability to make sure that I'm protecting the community, not only from future cases, but also from the cases that are currently going on within my community. So everything that I talk about going forward is going to be under the umbrella of protecting the community. So collecting the data and guiding the data to the correct areas is needed. I think this is very important for me to do. Collecting the data, of course, will come from a lot of different resources, CDC, epidemiologists, things of that nature, and really getting that information to the people that would need it, such as hospitals and different agencies, according to that. Also, it is my role to coordinate with other government agencies in the public health sector, such as the DPHS or the DES. And most importantly, I'm going to slow and prevent future infection. One of the biggest things I think I can do, let me move this away here, is be a liaison between state officials, local elected officials, and the community at large. The community that we live in can be as small as we make it and as large as we make it. And unfortunately, the larger we go, the more communication that is needed between the officials that are in charge. So as the chief medical officer, it is my job to be that liaison between everybody at large within the communities to make sure that we are all working not only to help the people within the community, but also the people with the outside that could be affected also. And a way that I can do this is to enforce laws, rules, and regulations that has developed as a result of this outbreak. We have various organizations that are giving input onto what we can do to stop this disease. As a chief medical officer, it is my responsibility to make sure that these laws and these rules and regulations are sound and being enforced upon the different agencies that I influence. So what changes will be made? I think was an important question that is going to be asked of the chief medical officer during this time. And I think ultimately what we should do is to look at the data and to understand really what the disease is compared to other diseases of similar um, growth in the past. And one of the ways that we did that, especially in the class in the epidemiology lecture, was we looked at the R. So for this virus, the R not of this is about 2 or 3. R meaning that amount of people that can be affected within a given room. They believe the virus of this one is about a 2 or 3 as compared to the influenza virus, which was R1, meaning that the amount of people infected that have the possibility of infected is very much more than that of influenza, meaning that there is an exponential growth associated with this virus compared to the influenza virus. With the data we were given, the case fatality rate would be about 6% as of the last data set that we had. This case fatality rate is pretty high. So that's something that would weigh into the decisions I make going forward. And then also the series interval being 5 to 7.5 days. I think that's an important factor to look on too, and to determine whether or not to implement certain legislate or certain rules going forward into the community that I have. The first thing that I would like to do as the chief medical officer, of course, would be the social distancing. We saw how the R number was very high. And because of that, I think the first thing I would do would be to make sure that I have stay-at-home orders for non-essential workers, and also recommend social distancing for gatherings larger than 6 people. This is just to slow the initial surge that we're going to have within the community of people going to the hospital. So this would be one of the first things I would do as a chief medical officer, and to work with different people on different organizations to make sure that this is implemented within the community at large and through my recommendation. Another thing would be, of course, the mandatory masks. In all public settings, I believe it would help the most, and to reduce the spread of the virus going forward. This is another thing that I can't, but that I can recommend as a chief medical officer going forward, is the use of mandatory masks for all people within a public setting. One of the key factors of a chief medical officer that I can have a lot of influence on is the changes to the healthcare setting and the healthcare clinics. I think one of the biggest influences that we have within a pandemic is not just how we change legislature or change rules in the community, but also how things change within the community of a hospital. So making mandatory social distancing for nurses and doctors, and as much social distancing as we can within that environment, because it's a high risk environment. Also changing the way that we treat patients, whether it's one-on-one treatment or phone clinic as we have currently. These are some of the things that I would recommend going forward as the chief medical officer. And also work with the local hospital officials to change the requirements for this specific disease, especially during an outbreak. A lot of times we mandate certain hospital protocols for a large variety of diseases. And I think specifically working with the hospitals for this specific disease would be important. And one of the also one of the things that a chief medical officer, I think I would find very influential would be the dissemination of the information to the public at large. I think that the public at large is looking to the medical officials as the primary source for sound information when it comes to the disease, but not just when it comes to the disease, but also the impact that it's having within the community that they're involved with. So I would work with the Department of Public Health Services and the Bureau of Communicable Disease in educating the community. This is a hard concept, or it's an easy concept, but a hard to implement, because people get information from so many different sources. And because there's so many different sources, I'm not sure, there's so many unreliable sources. So going through pamphlets, I think, would be a great way to educate the community because they know it's coming from a source that is reputable. TV is also something that we may look into for public health information dissemination. The internet can be hit or miss because there's a lot of various misinformation out there. But I think something that should be explored, that I would explore as a chief medical officer, is being very open into giving seminars and to giving public addresses to the community that I'm serving as the chief medical officer. So those are the things that I would do within the case study of as a chief medical officer. And thank you.